We're working with communities on addressing the needs of the opioid crisis's youngest victims. So really looking at the needs of children who've been impacted by parental opioid use disorders, caretaker opioid use disorders, and so this ranges from, a variety of different traumas, from being born with neonatal abstinence syndrome. It may also be children who've witnessed or suffered from physical abuse as a result of a parent who's been struggling with opioid use disorders. Many children we see are facing sexual abuse or looking to overcome sexual abuse, and a variety of other sorts of abuses. And so through this focus on identifying and really meeting the needs of these young survivors, we're going to be able to, again, collaborate with communities and really see, what are the different solutions, whether that's through evidence-based programming, new models of care, new care coordination approaches. And so we'll look at those different options and see what fits within communities. We'll also be able to help the community look at, the holistic response, the comprehensive response. And so, what is the community willing and able to do once they identify the unique needs of this child population? It's really important work. I think it's going to really lead to some cutting-edge responses for the young victims and overall result in healthier children as a result of this work. This is one of the first initiatives that I've seen in the country that really focus on this young population and, again, the victims of the opioid epidemic. We work with a variety of communities, urban settings, many of them in rural areas as well. We also do quite a bit of work in tribal communities. One example of a tribal community we've been working with was around implementing some evidence-based substance use disorders treatment services for young people and adolescents and their families. As we began working with the community, we felt it was really important to get to understand, where the community stood in terms of readiness to implement a specific intervention. As part of that process, we worked really closely with tribal elders, tribal leadership, to get that comprehensive understanding. We've done some work in Latino communities, again, working with programs to adapt models that are existing to make sure that they align with the values. Coming from a Latino community in Arizona, it was important for me to be able to explain to the young people that I worked with, how a certain program, how a certain model really aligned with the way they may have been brought up. The cultural values that I grew up with, things like familismo, machismo, these are things that, as a young man, were important to me and my family. When speaking with my dad, he would always talk about the importance of taking care of one's family. And so as we look to adopt programs that were culturally relevant and culturally based, it was important that these key elements, made an appearance, and a significant one, so that the young people we were working with in those communities could really see, okay, these concepts align with the way that I've been brought up, and therefore make it easier for them to be able to make those changes and adopt different behaviors as a result. In doing our work with communities, we really look to engage the various sectors, whether that's healthcare, public health, law enforcement, it could be the courts, it could be child welfare, it could be businesses, and really looking at those multiple sectors and helping each of them identify the role that they may play in the solution to an issue. The opioid epidemic is one example. In our work right now to meet the needs of the children of the opioid epidemic, it's important that we really have a comprehensive response in communities. It is not just child welfare who will have a solution. As we consider the children of the opioid epidemic, it's important to keep in mind that the impacts of this trauma will last for many years, maybe decades. And so it's important that we consider that as we think about the solutions that we're developing now. We need to address the current needs of these young people, whether that's through trauma-focused services, trauma-informed care services. It may be training court-appointed special advocates in trauma-informed care and trauma-informed principles. A child who is born to a mother with an opioid use disorder will have very different needs at birth than they do when they're 15 or 16. And as a community, it's important to think about the comprehensive and long-term response that you will have in terms of services, other supports, and evidence-based practices or best practices that will help them throughout the ages. It's incredibly rewarding to do this work. We get to work with communities who are really actively seeking solutions to an issue that has, for the most part, overwhelmed their systems. It's great to hear the stories of new stakeholders who were excited to be part of the process. I know in several communities we've been to, engaging local law enforcement, having gone from a place where, law enforcement didn't want to administer naloxone or, wasn't sure why they were reviving people who had overdosed, to having kind of a renewed passion around it and seeing how, they're saving lives and helping keep communities and families whole.